さんこんにちは。今日は職場です。元気でいらっしゃいますか？日本は九州台風がまた来ているようで、大変だと思うんですが、もし九州の救命士さんいらしたらどうぞお気をつけください。こちらジョージアは、朝夕少し涼しくなって、過ごしやすくなったとはいえ、これディスパッチです。すいません、聞こえるかな。コンピューターがディスパッチをするようになってますという感じです。聞こえますか？どこまで行ったかな。少し、朝夕と涼しくなって過ごしやすいとはいえ、昼間はまだ暑いです。でも西海岸カリフォルニアですねの方は山火事で大変なようなので、そんなに文句は言ってられないかなという感じです。今日はですね、パラメディックスクールで勉強している同僚がいまして、患者観察の練習をしていたので、チェストペイン、共通、心臓発作のシミュレーションしてもらえないかと頼んで、やってもらったのを撮影しました。早口でちょっとごもごもと話すので、もごもごと話すので聞きづらいかと思うんですが、時々今までご紹介していたフレーズも話していますので、それを聞き取れるかどうか、聞いてみてください。それからステミープロトコールというものがありまして、心臓発作を認めた後に病院と連携するっていうものがあります。それも説明してもらっています。また、何かご質問やご意見がありましたらコメント欄にどうぞお書きください。すいません、音がうるさくて、こんな感じです。では、ご覧ください。
Arrival on scene, be it my scene is safe, I'm watching the patient, see if he's tracking me upon approach. Scene safety, not suspecting trauma right now. So now I'm trying to get a general impression of him. He looks very lethargic, looks like he's in pain. He's clutching his chest, so I'm going to begin asking him what's been going on, what is going on, how it started. So, sir, are you okay? What's going on?
I have chest pain.
What does it feel like?
It feels like pressure on my chest
How long has it been going on?
for an hour.
Has it happened before? Do you have history of cardiac issues?
No,
Okay, do you take medications?
no, I just take a Tylenol every now and then.
All right. Can I put blood pressure cuff on you and check your blood pressure?
Yeah, please help me. It hurts really bad.
All right, checking his vitals, his pulse ox, and his blood pressure.
Blood pressure comes back 90/60.
On your-
Pulse ox is at 94%.
Okay, so do you take anything for that?
I don't take any medication.
And this has never happened before.
No.
All right, can I get you in the back of my ambulance?
Yeah.
All right, so we'll move back to the back of the ambulance, put him in a position of comfort. In the back of the ambulance, we'll apply a 12 lead.
I have pain shooting up my neck right here.
Is that new? Does that just come on?
And it sometimes moves down my shoulder. I'm scared. I don't want
All right,
to
can you take nitroglycerin?
I don't know what that is.
It's a pill I put under your tongue that'll should make the pain go away. Might give you a little bit of a headache.
Alright, do you want to get the EKG first before you give me meds?
I'll do. I'm assessing.
Alright, I'm just scared. It's cold.
Are you allergic to any medicines?
Yes. I'm allergic to malaria pills.
At this point in time, I have my partner establish an ECG, or not ECG, but a line, so that in case the event I need to give any kind of medication, I've already got that established. I'll just show not tell. I'll be going V1 on each side of the, and V2 on each side of the sternum. Pretty easy to find the landmark because he's not overweight, he's not a big guy. V3 will go right down here, halfway between V2, almost halfway in line with it. V4 will go next. Ideally that would go right under the nipple line and it will stay in line with the V3, V5. We'll go halfway between V4 and his side over here. Then I'll put that up.
So he hooks up the EKG, and this is what we see.
What's on there?
It looks like you're having an inferior STEMI, sir. So you're having a significant cardiac event.
So the inferior MI is in leads 2, 3, and AVF. And you have to be able to recognize inferior 2, 3, and AVF. You want to withhold nitro until you get an EKG and a good blood pressure, because nitro can cause significant hypotension in your patient, cause all the vessels to dilate. The other finding we have on this EKG is in your V leads right here, in leads 2 and AVL. If you flip this EKG upside down and turn it around, it will look like ST elevation. So that means the right side of the heart is also involved. And if you give nitro to that, you can cause your patient to actually vasodilate and actually pass out from hypotension. So we don't give nitro to inferior MIs with the right sided involvement. You can give aspirin, but what the patient really needs is fluids. Lots of fluids to treat this.
All right, we've already got the IV established, at least the INT cap is in place. So I'm going to start a drip line of fluids and just see how the patient tolerates it. I'll start off with a drip. I'm going to get it flowing. I'm going to go from there and I'm going to monitor the blood pressure as we're going en route. Probably going to place him on a nasal cannula with a little bit of oxygen. If he tolerates it, we don't want to give too much because it can actually make the cardiac event worse. We can get into that later. We'll monitor him en route. We're not wanting to give any nitroglycerin at this time. We will give aspirin if he tolerates it, he has no allergy to it, and he's not already on blood thinners or anything like that. Do you take blood thinners?
No, sir. The only thing
So you will tolerate aspirin?
Yes, sir.
So I'll start off with giving him 324 milligrams. I'll direct him to chew them up as long as his level of consciousness is acceptable, which he's still talking to me, he's still in pain and everything, and weak and everything, and he's sweating, but he can still tolerate the aspirin. I'll give him that, and I'll want to monitor his blood pressure after that and monitor his overall presentation and his oxygen. Since I put him on a cannula, I'm going to continue to monitor him en route to the emergency department and hand the report over to the physician.
Very good. Thank you. Could you explain what we do for STEMI alert?
We have to fax the ECG over to the local emergency department that our protocol dictates and send it directly to the cath lab. Ideally, get the patient directly into the cath lab upon arrival. So we try to make that as much of a fluid process as possible.
In the ideal from entry to the ER to cath lab, we want to try to get there within 45 minutes. So they can go in there and put a balloon in to clean out the blocked vessel, or they'll go in there and they'll drip TPN to clean out, or not TPN, the clot buster to open up that vessel.
All right. Very good. Thank you very much.
You're welcome.
All right.
I'm firefighter John Grizzard, and I'm working on 5 years at the department. I've been an EMT for 6, and I'm currently pursuing my NREMTP certification, and this
Which is?
National Registry of Emergency Medical Technicians Paramedic.
Hi, I'm Daniel Curtis. I'm a retired military medic. I've been a paramedic for 16 years and 21 years as a military medic. Currently, I'm a paramedic here and a firefighter probie, getting my fire certs. But it's been a pleasure to work with you guys.
Thank you.